Chances are you've heard of amoxicillin. It's one of the most commonly prescribed antibiotics for everything from sore throats and earaches to dental infections. But what exactly is it? How does it work? And what's the best way to take it? Let's break it down in simple terms so you can use it safely and effectively. So, what is amoxicillin? Amoxicillin is like a powerful shield against bacterial infections. As part of the penicillin family, it works by stopping bacteria from building their protective cell walls, causing them to break down and die so your body can heal. Now, what are the dosage forms available in market? Amoxicillin comes in various forms to suit different needs. Adults and older kids usually take capsules, often 250 mg or 500 mg, while children may use chewable tablets 125 mg or 250 mg, or dispersible tablets of similar strength that dissolve in water. There are also oral suspensions, typically 125 mg per 5 ml or 250 mg per 5 ml, and oral drops for infants 100 mg per ml. Extended-release tablets of 775 mg are used for longer-lasting effects, and injectable forms treat severe infections. Adults generally take 500 mg every 8 to 12 hours. Kids' doses depend on weight, usually 25 to 50 mg per kilo per day. The maximum adult dose of amoxicillin is 6 grams. Follow the doctor's instructions carefully. Then, what is amoxicillin used for? Amoxicillin is a widely prescribed antibiotic that treats a variety of bacterial infections. For throat infections, especially strep throat caused by Streptococcus pyogenes, it's commonly used in ear infections, like otitis media. Amoxicillin targets bacteria such as Streptococcus pneumonia, Haemophilus influenza, and Moraxella catarrhalis, which are frequent culprits, particularly in children. It also helps with bacterial sinusitis, targeting bacteria like Streptococcus pyogenes. When it comes to respiratory infections like bronchitis and pneumonia, amoxicillin is effective against Streptococcus pneumonia, Haemophilus influenza, and Moraxella catarrhalis. For urinary tract infections or UTIs, it works against bacteria like Escherichia coli and Enterococcus faecalis. Amoxicillin is also used to treat skin infections like cellulitis, impetigo, and abscesses, which are typically caused by Streptococcus pyogenes and Staphylococcus aureus. However, for resistant strains like MRSA, other antibiotics may be needed. Dental infections, such as tooth abscesses, are another common use for amoxicillin. It targets bacteria in the oral microbiome, including Streptococcus viridans, Peptostreptococcus, Prevotella, Fusobacterium, and Porphyromonas species. Amoxicillin is also effective for certain stomach and intestinal infections. As part of a triple or quadruple therapy regimen with potassium clavulinate, bismuth, and proton pump inhibitor, it's commonly prescribed for H. pylori, which causes ulcers and gastritis. Additionally, it works against Enterococcus faecalis and Listeria monocytogenes, both of which can affect the intestines, especially in people with weakened immune systems. Overall, amoxicillin is a go-to antibiotic for a wide range of bacterial infections in the body. Then, now let's know if you missed a dose, what to do. If you ever forget to take a dose, don't worry, just take it as soon as you remember. But if it's already close to the time for your next dose, skip the one you missed. Make sure you never take 2 doses at the same time. It won't help you recover any faster and could cause problems. Also, always keep at least a 4-hour gap between 2 doses. Now this is time for side effects of amoxicillin. Amoxicillin, like all medicines, can cause side effects, though not everyone gets them. Stop taking it and see a doctor immediately if you experience serious side effects like allergic reactions such as itching, rash, swelling, or difficulty breathing, severe skin reactions like red patches, blisters, peeling, or changes in skin color, flu-like symptoms with a rash, yellowing of the skin or eyes called as jaundice, severe diarrhea with bleeding, or unusual bruising. Rare reactions include vomiting, crystals in the urine, or symptoms of blood, kidney, or liver problems. Common side effects are nausea, diarrhea, mild rash, or headache, and usually go away on their own. Always report side effects to your doctor. Who should be careful with amoxicillin? If you're considering amoxicillin, be cautious if you're pregnant or breastfeeding. Check with your doctor first. Also, if you're allergic to penicillin or similar antibiotics, inform your doctor. If you have kidney or liver issues, your doctor may adjust the dose for safety. Always consult your healthcare provider. Amoxicillin can have side effects like dizziness and convulsions, so avoid driving or operating any heavy machine unless you are feeling well. Here comes drug interactions. What to avoid? If you're taking allopurinol for gout along with amoxicillin, you might be more likely to have an allergic skin reaction. If you're on probenecid for gout, your doctor might need to adjust your amoxicillin dose, as probenecid reduces the excretion of amoxicillin. If you're taking blood thinners like warfarin, you may need extra blood tests. Amoxicillin may also be less effective if you're on antibiotics like tetracycline. If you're using methotrexate for cancer or psoriasis, combining it with amoxicillin can increase side effects. Always inform your doctor about any other medicines or supplements you're taking. Here are the important tips. Take the full course of amoxicillin even if you feel better early. Stopping too soon can make the infection come back. Always follow your doctor's advice on dosage. If you feel unwell or develop any new symptoms, contact your doctor immediately. Now, what are the final thoughts? Amoxicillin is a trusted and effective antibiotic when used correctly. It helps fight bacterial infections, but it doesn't work for viral infections like the common cold or flu. Always take it as prescribed and never share antibiotics with others. If you have questions, don't hesitate to ask your doctor or pharmacist. They're there to help. Stay safe and healthy.